So I'm Susannah Copland, and I'm excited today to be talking with Dr. Matt Coward about fertility supplements. What fertility supplements do you recommend for your patients who are trying to build a strong foundation for fertility?
So a daily multivitamin, sometimes fish oil, if they have a diet that's deficient in fish, for example. But I really stay away from the expensive combination antioxidant supplements. I really feel like antioxidants should be something that comes naturally in the diet. And so we recommend a heart-healthy diet. And as you mentioned, all of the different antioxidants, you just rattled them off.
Yes, I love omega-3, well, I love to eat. So omega-3s through fish, chia, flax, walnuts, antioxidants through fruits and vegetables, kale, artichokes, berries, seasonal delights. So food first, but then I'm happy to hear that the supplements that you're sharing are actually in complete harmony with the supplements that we recommend for eggs. So a prenatal vitamin, fish oil if you don't eat omegas every day. And for our patients with PCOS, inositol has some pretty good data. And for our patients with reproductive aging, some coenzyme Q10. But a more simplified list, I think, is what has the data behind it.
Now, how often are you seeing couples asking about male fertility antioxidant supplements? Is that something you're...
Frequently. Not only that, but I would love to hear your thoughts on the male fitness supplements.
Sure. So as far as the combination antioxidant supplements, large randomized controlled trials show they really make no difference. And so that's why I stick with the just daily multivitamin and keep a simple approach. They're so expensive and they really haven't been shown to do anything. For workout supplements, now that's a problem. This is a problem I see a lot because they're so common. So many men are in the gym and that's good for you to be in the gym, but what's not good for you is all the powders, the extra proteins, all of the supplements, some of which we don't even know what's in them. So these workout supplements can say they build muscle or do other things, but what they've really got in them are little androgens, like testosterone. And when a patient takes testosterone, it actually shuts down their natural fertility. So a lot of these workout supplements do the opposite to fertility of what you would think. So they do make you stronger, some of them, but they can actually downregulate your sperm production. And you can end up with infertility because you've been taking workout supplements.
I think that's really important to get out there, and I also think it pairs nicely with what we recommend for our support of eggs, which is exercise is great, but not to exhaustion, and the way to fuel yourself is hydration and through good nutritive eating.
Are there any supplements you would say to stay away from?
Well, there's such a long list of ones that don't have kind of evidence-based I agree with you, they do cost a significant amount. So I've tried to kind of keep to those top: prenatal vitamin, fish oil, inositol for some, coenzyme Q10 for some, and then of course if they have a deficiency like a vitamin D deficiency or an iron deficiency, we're going to be supplementing those as well. But beyond that, when people ask me, I say I just don't have the data to tell you that that's something you should do for your fertility, and so I generally say let's not.
One thing people they don't realize, and I know as a urologist because we see this, but high doses of vitamin C actually cause kidney stones. So all vitamins at high levels are not good. I mean, you can actually overdose on vitamins or cause other symptoms and side effects.
We do see, that is something I've seen also in patients who, for some reason, have read that they should take multiple multivitamins, and of course the fat-soluble ones, especially vitamin A, you don't want to get too much of. So it is always a good idea in our visits as we're talking about your next step planning to provide us with a list of what you're taking, because we may simplify your life.
Yeah, it is important. Every time you meet with your doctor to talk about what you're actually taking, not just prescription medicines, but the powders, the creams, the vitamins, the root extracts. All of it is potentially could interact. So we need to know what you're on in order to be able to help.
Well said.